This is a specimen showing anatomical landmarks of mandible. So the intraoral landmarks are divided into three types: limiting structures, stress bearing areas and relief areas. So starting with limiting structures. So the limiting structures of mandible are labial frenum, labial vestibule, buccal frenum, buccal vestibule, lingual frenum. This is the alveolingual sulcus. The alveolingual sulcus is divided into three regions: the anterior region, middle region and posterior region. The anterior region starts from lingual frenum till the mylohyoid ridge curves. The middle region starts from premylohyoid fossa to the distal end of the mylohyoid ridge, and the posterior region starts from where the flange passes into the retromylohyoid fossa. So next intraoral landmark is the stress bearing areas. The stress bearing areas are divided into primary stress bearing areas and secondary stress bearing areas. The primary stress bearing areas include the buccal shelf area and the retromolar pad. The buccal shelf areas starts the anterior extent starts from the buccal frenum. The posterior extent is the anterior edge of the masseter muscle. Medially, it is surrounded by the crest of the alveolar ridge and laterally by the external oblique ridge. Coming to the contents of the retromolar pad. So, the retromolar pad is a triangular pad of tissue at the distal end of the residual ridge. The anterior portion of the triangle is the keratinized tissue and is a remnant gingiva of the third molar called pear shaped. The posterior aspect of the triangular tissue, that is the retromolar pad, is non-keratinized tissue. It consists of fibers of the temporalis tendon, buccinator muscle, superior constrictor muscle and pterygomandibular raphe. Coming to relief areas. The relief areas of mandible are the secondary stress bearing areas, genial tubercle, any undercut or tori and mental foramen.